I'm Clark Petty. I'm from here in San Antonio Metro Health. We welcome everyone to San Antonio and hope that you find a little time while you're here to enjoy the Riverwalk and some of the other things our wonderful city has to offer. I've known Jason for several years, and every time I hear him talk, it's such an inspiration. He is very passionate about what he does and always builds a fire underneath me and wants me to get out and makes me want to get out and take action, and I hope that'll be the effect he has on you today. Jason's the founder of Frontera Strategy and is known around the country as an effective strategist, community organizer, and coalition builder. He's a consultant and speaker on political strategy, education, human services, and nonprofit issues. Mr. Sabo specializes in assisting organizations and foundations develop advocacy strategies for challenging fiscal and political circumstances. Prior to launching Frontera, Mr. Sabo worked at the Texas Capitol for more than a decade as a policy analyst and lobbyist. Jason's developed and implemented complex multi-year advocacy efforts that have resulted in changes to law and policy impacting millions of children and families. His work also involves assisting foundations and other philanthropists to most strategically invest their dollars to achieve policy change. Mr. Sabo also has experience as a teacher in the U.S. and Brazil. He's coordinated community-based youth employment, dropout prevention, and immigrant family literacy programs. He received a master's degree in history from Indiana University. And I will go ahead and give the mic to him and let him get started. We got a wonderful presentation.
Great. Thank you so much, Clark. And how many of you have never been to the Immunization Partnership Summit before? If you're a first timer, I have to say, if Anna were here, I would embarrass her as I did the last time I did this. I've been working for the partnership since like 2007. This is a really amazing organization, and it's pretty incredible that when I started working for Anna, 7, 8 years ago, it was literally on her kitchen table, and now there are 450 people here at this event, which is truly extraordinary. So kudos to you for coming. Thank you for what you do, and thanks for especially your support for the stuff we're going to be talking about today. So as Clark said, my name is Jason Sabo. I live up the death corridor, lovingly known as I-35, in Austin, Texas, and I will be actually running out of here at 4 o'clock to go to an Austin High football game where they hopefully won't lose by as many points as they tend to most weeks. But it's all about the academics, I guess, at that school, unfortunately, I suppose, as a Texas parent. My comments today are going to reflect, are going to focus on the legislature, what's happening in Austin. I think that we all know from the immunization perspective that much of what happens at the Capitol impacts the work that you all do. The policies that you implement, the funding that determines whether or not, or whether we do or do not as a state have adult vaccine availability, the laws and requirements related to immunizations for access to a whole host of things. We're going to talk about all of that. But at the outset, I am required to do, a quick disclaimer. Yeah, there she is. A quick disclaimer about the fact that I am not, I have no conflicts. If those of you who are getting the educational credits, I'm completely unconflicted. Okay, there I said it. I'm emotionally conflicted deeply personally, but with regards to the financial stuff, no conflicts. Okay, so as I said earlier, I've been working with the partnership since about 2007. And when I started working for the partnership, this is what I was dealing with every day. Every time I would go to the legislature, I might as well have walked in and had like this giant Jenny McCarthy behind me. Because anytime we went anywhere at the legislature, we had to deal with that. We had to deal with the misinformation and hysteria caused by people like Jenny McCarthy, who in American popular culture, we might as well put an MD after her name. Because, as far as we're concerned, this is where we get our scientific and medical information as a society. And when I would go to the legislature, until very, very recently, friendly offices, unfriendly offices, they didn't want to work with me. They didn't want to work with the Immunization Partnership. They didn't want to work with you and Anna on issues related to immunization policy, not because they disagreed with the science, not because they didn't think that you were right. They didn't want to deal with that. They didn't want to deal with the anti-immunization advocates. We, the people who think that immunizations are as commonsensical as clean drinking water, we lost the argument. We let the crazies, in my opinion, excuse the language, we let the crazies have the day. We let them control the conversation. And when we allow science to take backseat to hysteria, this is what we get. And for years, that's what we had. But because of people like you, because of people who are in the trenches, because of people like Jamie Shambaum, who has spent hours at the Capitol, so all of a sudden vaccines and vaccine-preventable diseases went into popular culture from this to this. Who's this? Anybody know? Kim Kardashian and Kanye West. And I always say, as an aging white man, vaccinate me against whatever Bruce Jenner has, because Jesus, I don't know what it is. Just shoot me up. I don't want it. But there's a vaccine for that. But so we went from the hysteria to some pretty sound public health policy, because they just had a baby, right? You know what she said? She said to all of her family, if you don't get a vaccination against pertussis, you're not allowed in our mansion. And okay, that's pretty cool. So you think about where we as a society have gone. We went from this, vaccines cause autism, to you ain't getting a vaccine, you ain't seeing your grandbaby. That matters. That, believe it or not, from the political policy perspective, this kind of conversation matters. It matters that these people have been discredited, and that now immunization is something that is cool, not just good medical practice, but in a weird kind of twisted way, cool and hip, all right? Now, that's a good thing, and here's why. Because that conversation in popular culture plays itself out in our politics. And if you think that it doesn't, you actually are assuming that the people at the legislature aren't responsive. The people, this next legislative session will be entirely about what we talked about between October 1st and the November elections. That's how we function as a civil society. We focus on, we lurch from crisis to crisis to crisis, except when things within the popular culture kind of intrude upon the political culture. And this is one of those things that intruded, and we won. Science is winning this conversation, and it's making advocacy around immunization issues possible. Not just easier, but literally possible. Now, when you look at where we are as a state, everybody's looking at what happened this week in the elections, and if you listen to the national media and the state media, they're like, oh my God, this amazing thing happened. It was like, oh, the sky is falling if you're a Democrat, or if you're Republican, we're like, yes, we finally got what we want, power. But you know what? Kind of the title of today's presentation, everything is different, nothing has changed. So our Texas Senate was really, really conservative before Tuesday's election. Our Texas Senate is now really, really conservative. Okay, so we went, really, it's a gradation of conservative, all right? So when you look at where we were, here, if you look at the last 4 legislative sessions, what do you notice about the Texas Senate? Absolutely no change. The numbers are the exact same, the same number of Republicans, same number of Democrats. Until Tuesday night, anybody from Fort Worth, Tarrant County in the room? Wendy Davis's Senate seat flipped from Democrat to Republican when the Republican won that seat that was open, and that's number 20 right there. Meaning that Donna Howard, who was here last night to hear Donna Howard speak, the state rep, Donna Howard is the last white female Democrat in the entire Texas legislature, House and Senate. Okay? And we'll talk about that in a minute, because that kind of stuff matters, kind of racial polarization affects politics. But we're seeing this play out right here in the Senate. And what's important to remember about the Senate is the numbers are the same, but every year the people in that red column have gotten more and more conservative. So 2011, these Republicans are more conservative than these. 2013, these Republicans are more conservative. They're the same numbers, but different faces and different ideologies, more conservative. People generally in the legislature think right now that this batch of Republicans in 2015 in the Senate will make the Texas Senate in 2015
the single most conservative legislative body in Texas political history. 8 of the 31 members of the Texas Senate are going to be freshmen in January. And of those 8, it's easy to say that 6 or 7 of them are more politically conservative than anyone currently serving in the Texas Senate. The Tea Party wave is coming. The Tea Party wave isn't going to crest here, I don't believe, until a couple more election cycles. So if you look at where we are in the Senate, it's definitely more conservative. Now, go over to the other side, the House, and it's still really conservative. Did it get really conservative? No, it didn't, but it's still really conservative. And one thing to note here is that in the Texas Constitution, you need to have a supermajority, which is 100 votes of the 150 members of the Texas House of Representatives. That supermajority allows you to amend the Constitution, use the rainy day fund, that kind of stuff. The Democrats lost 3 seats. The Republicans gained 3 seats in the Texas House by Tuesday, meaning that they are only 2 votes away from that supermajority. So all they've got to do is find a couple of these dudes to come over and join them, and which isn't that hard to do. I mean, come on, it's politics. And then they can get the supermajority for the Republicans. And that, I think, is a really, really big story. Most people didn't see this increase coming. Most people thought the trend line was going to be like this. But I think that it's interesting that there are now 5 Hispanic Republicans in the Texas Legislature, including 3 of whom were elected this week. So we're beginning to see this idea that Latinos vote monolithically Democratic is very much changing. And it's interesting, I just read something this afternoon, 44% of Texas Latinos don't support in-state tuition for immigrant kids. The Dreamers, 44% of immigrants don't support in-state tuition for immigrant kids. 4% of Hispanics. So when we think, and which is a Democratic position that Democrats have taken, and we've heard Dan Patrick talking about, he doesn't support that. So in many ways, the assumption that people have about how the Hispanic bloc of voters will vote was blown apart this session. I think we really saw that in the House elections. Now, when we think about the real elections, though, this is a big show that happened this session, right? This electoral cycle. So let's go through this really quickly. Who's this guy right here? And when he got just elected governor? Who's this guy right here? Joe Strauss, the Speaker of the Texas House of Representatives from here in San Antonio. Who's this guy right here? Dan Patrick, Senator, Chairman of the Senate Education Committee, the new Lieutenant Governor of Texas. Who's this right here waving goodbye? Whitney Davis. Who's this right here waving goodbye? Leticia Vanderkam. That means it can't be let go. She will not be coming back to the Senate. She will be coming back to the Senate. She, at the end of every redistricting round, you get a 2 or a 4. You randomly pick a number from a hat. If you get a 2, you have to run for your Senate seat for 2 years. If you get a 4, this is how our democracy functions, random chance. If you get a 4, you don't have to run for re-election for 4 years. 2 years ago, she got a 2, she got a 4. If she got a 4, she would still have her Senate seat. She got a 2, so she's out. She got a 4, so she's in for at least 2 more years, presumably the minority member of the Culture and Tourism, because that was our question. Now, we get a lot of grief as a state, some of which I'm about to dispense, about a lot of things. But you tell me another state in the United States where a guy in a wheelchair, the first Jewish speaker, a guy who is admitted to serious depression issues in his past, a former single mom, and the first Latino run for governor, and a guy who's married to a Latino. You tell me another state in the 50 United States that has that kind of diversity at the top of its ticket. Did y'all get what you wanted out of the elections? Maybe yes, maybe no. But regardless, you gotta give Texas some credit for the fact that we are jerking slowly but surely into the 21st century. And I think that the people at the top of the tickets are a reflection of the fact that change is here, change isn't coming, change is already here to grab it for the corner. Now, it's really important to talk about what all this transition here and here means. Let's start with the governor's office. And if you look, the governor of Texas is considered constitutionally to be very weak. Why is the governor considered to be weak?
because the governor doesn't have a lot of power compared to the lieutenant governor, particularly with how the legislature itself functions. How long has Rick Perry been the governor of Texas? And too long is not the right answer because that's somebody always says it. What year did he become the governor of Texas? December of 2000, okay? So we are looking at, he's knocking on the door of 14 years. He's record-setting, longest-serving governor in Texas history, okay? It's a really long time, 14 years. We don't have term limits in Texas. I personally oppose term limits. Why do I oppose term limits? Because I'm a lobbyist. If you want people like me, who are the cockroaches of the system, to have more power than you can imagine, create term limits. Because then your institutional memory is no longer held by elected officials, it's held by paid hacks like me, okay? That's why term limits are wonderful for lobbyists, because they give us all the power, okay? Now, if you think about the governor, we've always thought of our governor in Texas as being pretty weak, right? But our governor in Texas, if you're in power for 14 years, he has not only appointed everybody that he can appoint to any state level position or board, he's appointed them and their successor. So it has been a massive consolidation of power in the executive branch of Texas government that is unprecedented in the state's history. And why is that important? How many of you have ever heard of the Texas Board of Professional Engineers? Okay, just don't raise your hand. You don't count. I mean, you're like the third person in hundreds of places I've given a speech. But every building you go into, they're responsible for ensuring your safety, right? Those people. How many of you have kids in public schools? All of that stuff. These are all state agencies, right? But if you think about how our state agencies are functional, between the Health and Human Services Commission, the Higher Education Coordinating Board, which is the colleges and universities, and the Texas Education Agency, which is K-12, those three agencies, as we'll see in a bit, represent 85% of the state budget. 85%. All these other little things, they're tiny, but they regulate billions and trillions of dollars of commerce. We focused a lot of attention on the money that the legislature itself spends your tax money, but that's chump change compared to what really matters, which is the regulatory infrastructure that regulates business, commerce, and everything else that happens in the state. That's trillions of dollars, not a measly few billion like the state spends itself. And the governor is responsible for picking the people who manage the agencies that regulate all of that stuff. Now, in Texas, if you're the head of a state agency, you have to go through the nominations committee of the Senate. The Senate will then, by the end of the session, have to give you a thumbs up or a thumbs down. The Texas Senate in 2015 is going to be more what than ever before? Conservative. The nominations committee of the Texas Senate, therefore, will be more what than ever before? Conservative. Therefore, meaning that if I'm the governor, I'm only going to appoint people that I know will be able to pass the muster of the incredibly conservative Senate Nominations Committee. So all of this, remember, is beginning to stack up where things are becoming much, much more conservative, both in the legislature and then as a result, indirectly, other places within state government. Now, the lieutenant governor is always considered to be very powerful because of the power that he or she has over the legislative process as the president of the Texas Senate. The current lieutenant governor is a guy named David Dewhurst. He's about 6'4", he's wider than I am, and he was a CIA operative in Bolivia in the early 70s. He must obviously be a master of disguise to pull that off. I mean, how could that guy blend in Bolivia in 1972? Come on. Here you see the most powerful person in the state of Texas, who is the Secretary of the Senate, Patsy Spall over here, but that's a different story. The lieutenant governor here with all of the members of the Senate. It's pretty obvious who the power guy is here, right? So what the new lieutenant governor, Dan Patrick, is going to do is appoint the chairman of all of the Senate committees, because he's a new lieutenant governor, so all of the committees are going to be new, meaning new leadership, new direction, new policy focus for every committee of the Texas Senate, unless he reappoints some chairs. During the campaign and the primary, he said that there would be no more Democratic chairs. Since the primary has ended, he's been reminded that people like John Whitmire like being a chairman, and Dan Patrick likes the use of his knees. So he too has kind of waffled on this idea of whether or not there will be no Democratic chairman. because I know I wouldn't want to make somebody like John Whitmire mad by telling him, no, sir, you are no longer the chair of the committee that you've been serving as the chair of, Mr. Dean, the longest serving member of the Senate, for about a decade. So Dan Patrick will be picking the new chairs, which is a really, really big deal. Now, why is it such a big deal? Why is the makeup of these committees so important? These are the education committees in the Senate and the education committee in the House. What you want to know, why am I throwing up education? Because education, the makeup of the education committees is, I think, really, really interesting and kind of a window into larger Texas politics. So look at the people on the left, those are the Democrats. Look at the people on the right, those are the Republicans. Remember, here were your two lieutenant gubernatorial candidates, which made interim hearings really interesting to watch the two of them kind of like, jockey in position around one another. Now, this is, again, the Senate, Democrats, Republicans. This is, again, House, Democrats, Republicans. What do you notice about every Democrat? What do you notice about every Republican? Anybody? White. All white. All the Republicans are white. All the Democrats are black or Hispanic. What percentage of the Dallas Independent School District is white? Anybody know? 8. What percentage of Houston ISD is white? Anybody know? The two hugies. Anybody know? 4.8% white. So why do we have racial polarization of our politics? Because we have racial polarization of our society from the elementary school all the way up. Now, why is that relevant to the conversation we're having right now? Why is it relevant that we're beginning to see some kind of communication? We're beginning to see more, particularly Latino Republicans, a handful of African American Republicans coming into the legislature as well. So a little bit of cross-pollination, but things are extremely racially polarized and that doesn't happen by chance. I mean, we draw maps to make this happen, to protect incumbents who are Democrats and to protect incumbents who are Republicans. Now, here's what I see as I travel around the state that I urge you all to begin thinking of. How many of you come from a community that's west of I-35 corridor? Where are you from? Amarillo. So you come from west of the I-35 corridor up in the Panhandle. Kel Seliger with his peeps right here, one of my favorite members of the Texas Legislature, good man. 15% of the Texas Legislature comes from west of I-35, 15%. With all due respect, sir, you are powerless.
65-35 as far as population.
65-35 as far as population. And you think about what that means for West Texas. So if West Texas wants to, it can be an island off onto itself, and suburbia will come and take its money from its oil and take its water to the, Plano and Alamo Heights can have really green lawns. I mean, that's just the way it works. It's politics, man. Or, as we're beginning to see more and more often, this guy over here is Senator Royce West, who's from the south side of Dallas, low-income, predominantly African-American community. And you've got this guy right here, Eddie Lucio, who is the senator from Brownsville, right in the Rio Grande Valley, right on the U.S.-Mexico border. As I travel around, and I'm in Kel Seliger's district, and I talk to the guy in the 20-gallon cowboy hat, he says to me in a drawl very much the same things that I hear when I'm in Senator Lucio's district, except they're in Spanish, and I can marginally understand it. And then I go to the 5th Ward, and they're saying the exact same thing that the folks were saying in Spanish and that the folks were saying in Texan as well. And I ask myself, why is it that these people who do not speak the same language, whose politics are supposedly completely different, why is it that they're talking to me and saying the exact same thing, but they're not saying it to each other? And that's, I think, where in the future success of immunization, advocacy, and advocacy on behalf of things like immunization lies. If we are attaching ourselves to one party or the other, we're going to lose. If we're attaching ourselves to one particular ideology or region, we're going to lose. The great thing about immunization politics is that it is apartisan. It is smart not to waste money on vaccine preventable diseases. It is smart policy to ensure that we have a functional immunization registry. There are some privacy issues. We'll get to all that stuff. What you guys do is not partisan. It's smart, okay? And that if you allow yourselves to get sucked into these partisan arguments, you're going to lose too. And the beauty of last night, the two people who were being honored, we'll talk about them in a minute. Were they Democrats? Were they only Democrats, or were they both? They were a Democrat and a Republican being honored last night. This is a very, very bipartisan issue, and the partnership has worked really, really hard to keep it bipartisan. Now, when you look at Health and Human Services and where the conversations at the Capitol are going to Health and Human Services, there's a lot of turmoil in, turmoil is, turmoil's, strong word, but there's nobody knows what's happening in the legislature around human services because the players are changing. You now know that this guy right here, Dr. Charles Schwertner, who's a senator from the north side of Austin, he is the new chairman of the Senate Health and Human Services Committee, replacing Senator Jane Nelson, who became the chairwoman of the Senate Finance Committee. So there, we know he's going to be there. And then we know that Senator Zaffirini, a longtime immunization champion, she's going to be there as well. So these are two kind of important Senate players in all of this, Democrat and Republican. Over here, you have a woman named Lois Kolkhorst. Lois Kolkhorst is from Brenham, where Bluebell ice cream comes from, and she is the current chair of the House Public Health Committee. She is retiring from the Texas House and will be running for the Texas Senate and will most likely be going over to the Senate. So we don't know now who the chair of the House Public Health Committee is going to be because the current chair is stepping down. I believe that it will be that the Speaker will most likely, not surprisingly, appoint another Republican to fill that vacancy, and I would be putting my money on one of these three people who are current members of the House Public Health Committee. Remember, I'm mentioning this committee specifically because it's the committee of jurisdiction for the issues that you guys care the most about, immunizations. Three people: Susan King, who's a nurse from Abilene, moderate Republican, although don't quote me on that because that's a dirty word to call somebody that. You have Sarah Davis from Houston. She represents the medical center, so she's obviously got an interest in a lot of this. Another moderate Republican, and a guy named J.D. Sheffield, who would have been here last night to be honored for his work last session, but was stuck in traffic in Austin, not surprisingly. And he was the guy last session who was always there to provide the medical scientific balance to the hysteria surrounding some of the immunization policy that the legislature was discussing. Really great guy. Who knows who the Speaker is going to pick, but I would assume that it would be one of these three. And I think, it'd be really interesting if somebody like J.D. Sheffield became the chairman of that committee. Very interesting. I think very good for the things that you all in this room care about. Okay, so what are the conversation around health and human going to be next session? Really, I think there are kind of 5 things that are shaping up within the immunization, within health and human services. They're going to kind of drive the conversation in the spring. First, Medicaid expansion. If Texas had chosen to expand Medicaid, every ACIP recommended vaccine would be available to every adult and the federal government would pay for it, okay? But we didn't. So now we have to figure out how we can essentially, in a very piecemeal way, offer some of those benefits. If we'd chosen to expand Medicaid, every CDC and ACIP recommended vaccine for adults and children would have been covered. Done. Over. We wouldn't be having the conversation we're having now about adult vaccines and whatnot. But we chose not to. We, collectively as a state, you can't point their finger at them. You did it too. You did it too. You did it too. We cannot, it's a cop-out to say they went up to Austin and did it to us. We went to Austin and did it to ourselves. You cannot, we are all in it together. We cannot just say we are not responsible for them because they are we are they. All right? And if you look at where Medicaid expansion has not happened around the country, not surprisingly, in a lot of Republican states, and unfortunately, Medicaid expansion has not happened in the places in the United States, the South, that have the highest rate of uninsured adults and children. So the place where it could have done the most, it's doing the least. This is the wrong question, wrong group to ask this question of, because you guys will say yes. How many of you have ever seen a baby with pertussis before? You guys would. So there you go. Right now, if it weren't for people like Jamie Shambaum, who's willing to go to the Capitol and talk about these kinds of issues, one of the problems we have with vaccine advocacy and politics of vaccines is the work that you guys do is just too damn effective. If there were more Jamie Shambaums, it'd be a lot easier for me to do my work. If you guys didn't keep people from getting these damn vaccine preventable diseases, if we had more people who had lost their legs, their fingers, and their palms, my job would be a lot easier. But you know what? People don't see the kid with pertussis. They don't see that kid. This is somebody else. It's not them. And we had a 53-year high incidence rate of pertussis in Texas last session. And why is that? Jenny McCarthy. It's the Jenny McCarthy effect. I personally think that, the great thing about working for myself is I get to say whatever I want. And I personally think that, the closer you are to a Whole Foods, the more likely you are to do that to your neighbor. I swear. It's amazing. And, I think that we're having a change of heart about how we talk about vaccines in this country. And we've always talked about parent rights, about parents have a right not to vaccinate their child. You know who else has a right? The parents of the child with an immunosuppressing disease, or the child itself, him or herself with an immunosuppressing disease. They have rights too. And it's about damn time that we start talking about their rights. But we're going to get there in a minute. Additionally, this session around Health and Human Services, we're going to talk a lot about this guy right here, whose name is Colton. Colton was a kid in the foster care system who was found in a field, half buried in a field outside of Austin, killed by his 20-year-old mom and her boyfriend. His mom had been out of the foster care system herself for about 2 years. So the legislature, we do a terrible job like every other state does in terms of our foster care system because we think we can do it on the cheap. And when we try to do it on the cheap, Colton dies. But I tell you, I've done this long enough. I've been living in a broom closet at the Texas Legislature for 15 years. Nothing passes a bill like a dead baby. I'm serious, it's sick, it's a terrible thing to say, but we're gonna do something about foster care, about CPS, about the fact that we have a disproportionate number of children aged 0 to 3 in this state who are dying. Why? Because we've run out of good ideas about how to keep their parents from killing them, apparently. Additionally, so that's going to be a big topic of conversation in this session on that cheery note. Additionally, I think that electronic medical records, no vendor here, this is really the picture that you get when you Google electronic medical records and click image. And finally, how many of you are following or aware of what's called the sunset process? So every 10 years, and this is one of my favorite places on the planet, Sunset on Siesta Key Beach in Florida, where my wife grew up. Every 10 years, every state agency is required to go through sunset, which means that they're reviewed and the legislature has the opportunity to just say, we don't need you anymore, you should go away. About 10 years ago, in 2003, the legislature examined all of its health and human services agencies and through a really controversial piece of legislation, consolidated those 12 different agencies into 5 agencies. That was 2003. We like to do things that are big and disruptive at about once every decade. So we are the train's just about here for something big and disruptive in terms of health and human services state policy. So I think that this legislature, this session, is going to do something huge and massive around reconceptualizing how the state agencies implement things like all of our health and human services policies, which would include the Department of State Health Services, where things like immunization, the immunization registry, are housed. So the very context in which you're doing a lot of your work could be changing dramatically within the next 8 months. The agency that you work with most closely now may not exist in 8 months. Remember, these big sunset bills are called Death Stars when they go through the political process. What did Luke Skywalker manage to do pretty easily to the Death Star? Remember in Star Wars? What did he do? Blew it up, right? I mean, you know, these big sunset bills are really easy to blow up. So we'll see how serious they are. But a lot of new members, a lot of people who came in with a pretty big mandate about shaking things up, reducing the size of government, it's a perfect opportunity for them to kind of live up to the mandate that they were elected to do, which is to shrink the size of government by simply reducing the number of agencies. Even if we're spending the exact same amount of money and they're doing the same stuff, at least we reduce government by having one agency instead of 5, kind of thing. But they'll still make lots of cuts too, probably. Now, all of this to say, this is kind of where we're going into next session. Now, those of you who are coming from West Texas know that Texas has been producing a lot of oil lately, oil and gas. Oil and gas drives our rainy day fund at the legislature. So those of you from West Texas, your roads are trashed. I've driven from La Mesa to like Lubbock or Midland, and I'll never forget, I'm driving down this road, I'm like going 80, and it's a 2-lane road, one way each direction, I'm going 80, and an oil drilling rig passes me in the left-hand lane, going like, just blowing me away. I had to be going like 100 miles an hour. I'm like, okay, I will never do this drive again, it is so dangerous. And all those communities out west are putting up all that money into the rainy day fund, and when the oil and gas prices were surging about a year ago, people at the legislature were saying there is going to be so much money. Back then, a year ago, we were the richest state in the richest country in the history of the planet a year ago. I mean, think about all that oil money. Now, oil has dropped down to about $75 a barrel, below the $80 threshold, which everybody says is the break-even point or break money point for a lot of production in West Texas. The oil prices are down. And you know what? This morning, you woke up in the richest state, in the richest country in the history of the world. If we're choosing not to do things like adult vaccines or having a functional immunization registry or helping kids go to college with a meningitis vaccination so they don't become a Jamie Shambomb, it's not because we don't have the money, it's because we don't have the will, okay? Now, very quickly, looking at the money, this woman right here, Jane Nelson, was the chair of the Senate Health and Human Services Committee last session and is now the chair of the Senate Finance Committee. Be aware, the first woman in Texas history to ever chair the Senate Finance Committee, which is pretty cool. And now the House Appropriations Committee, this guy right here is the current chairman. He stepped down, didn't run for re-election. So 3 guys are kind of in the running, people think, for appropriations. Representative Otto, Representative Darby, and Representative John Zerwas, who's a doctor, big-time immunization advocate. He would be a great champion for immunizations. Worst case scenario, he'll return as the Health and Human Appropriations Subcommittee chair. And he's a great guy on immunization issues. Now, looking really quickly at how Texas spends your money, this is just the $95 million we spend every 2 years of Texas state general revenue money, not all funds. But look at this, 84% is education, health, and human services. Throw in prisons, get you to about 93%, okay? Why do bank robbers always rob banks? Why do appropriators always cut education, health, and human services? That's where the money is. We don't spend any money on nothing else. You can decimate all that stuff if you have budget shortfall or want to make cuts, and it's a drop in the bucket compared to everything else. We just don't spend a lot of money. Now, immunization policy specifically, there are a few things to be mindful of. Number one, pertussis. There was an interim charge related to pertussis, this interim, and I think that the legislature is going to do something related to pertussis going into this spring. I think that the Ebola outbreak, we'll talk about that in a minute, has kind of opened up a big conversation about the public health infrastructure and the fragility of our public health infrastructure, and in doing so, creates an opportunity to talk about things that are way beyond Ebola, okay? Additionally, the immunization registry. How many of you think that we have to do something about our antiquated opt-in immunization registry and think it is a complete, the most fantastically non-functional, inefficient way to spend taxpayer money? Last session, we passed reform bill out of the Texas House. It was a knife fight. Donna Howard and J.D. Sheffield were the knife wielders extraordinaire on that bill. Jay Nelson was the chair of the Senate Health and Human Services Committee, didn't give the bill a hearing. Bill died. She is now in an even more powerful position. So my gut tells me that significant reform of the immunization registry along the opt-out lines is going to be very, very, very politically difficult, if not impossible. I'm just being straight up honest. However, there is conversation about the fact that years ago, Jay Nelson passed a bill that allowed people between the ages of 18 and 19 to tell the state, please don't delete my data, my immunization records. I'm going to need those when I apply to college, apply for a nursing certificate or a CNA or something like that, or community college or whatever, okay? The records are kept until 19. God knows that on everybody's 18th birthday, the thing they're most excited about doing is calling the Department of State Health Services and asking them to maintain their immunization records, okay? We're proposing that that age be extended to 26. That would be a huge help for kids going into college, a huge help for kids going into community college and getting a degree of some kind. That is totally doable, wouldn't cost the state a dime, and would have a fundamentally huge positive impact on public health. And they will fight it tooth and nail because those people between 18 and 26 who are adults did not themselves consent to having their records in the immunization registry. Their parents did. 90% of the opposition we get has nothing to do with public health and everything to do with privacy, okay? And that's a real problem that we need to confront. Last session, the registry bill that passed the House increased the privacy and security of the data in the immunization registry. And we still couldn't get the bill hearing in the Senate. Why? Because people like Jay Nelson do not hear from you guys. They hear from the privacy people, the anti-immunization people. The people at the Capitol do not hear your voices, ever, ever. They hear the voices of the people who think immunizations cause autism 10 times more and 100 times louder than they hear your voices. Your voices are silenced because you're not there in the conversation. If you're not there in the conversation, we can't get bills that we pass in the House heard in the Senate. It just doesn't, we need to have that groundswell of people. I also think that, again, as I said, Ebola opens up a truly fantastic opportunity for us to have a bigger, broader conversation about public health and the public health infrastructure. I was talking to somebody after the session a couple hours ago, and it was a woman, a professor, and she says, I'm still getting calls from the media, but the media calls have pivoted from, tell us about what's going on with Ebola, to why is our public health infrastructure such a wreck, okay? This is the conversation right now, and we can piggyback on the conversation in a way that applauds what we're doing and what we've done, but affords the opportunity to build on the good stuff that's already happening. Really quickly, and I always run out of time, I tell everybody this is not rocket science to get stuff done at the Capitol. It doesn't matter who's in power. It doesn't matter if they're Democrats, Republicans, conservatives, or liberal. The same stuff still applies. Doesn't matter. Everything is different, nothing has changed. Be focused, have good credible research, put that research in the hands of people that are not used to hearing from, not you guys, the president of the local bank, who has no reason whatsoever to care about immunizations, but does. If it's coming from you, it's inherently suspect, because you're paid to talk about it. Work the process, and don't alienate the agencies and the people who actually have to implement your bills. And that's it. Now, those of you who are Twitter people, I'm a Twitter obsessive, so please follow on Twitter, reach out to me, and I'm happy to answer whatever questions folks have, however much time we have. Questions? How dare you, tar and feathering.
We're at 10 to 4, so next session starts in 10 minutes. We can devote at least 5 minutes, probably. Questions?
Out of one.
What is the reorganization of your sunset?
It's a really good question. If I were going to bet, I would, you know, the question was, what's the reorganization of Health and Human Services under Sunset going to look like? We're going to have a special session. We're going to, you know, I'm not making any vacation plans. My assumption is that I will be living under the stairs at the Capitol the entire summer. I don't know if they can get it done. It's so big. And so many of them ran against Obamacare that it has to be substantive. I don't know if they can get it done in the regular session without having it maybe spill over into a special. My honest answer is, I think there's going to be consolidation. I think if I were at the Department of Assistive and Rehabilitative Services or the Department of Aging and Disability Services, I would be sweating right now. I would be working under the assumption my agency was being dissolved. I think that DSHS, the Department of Health Services, Dr. Lakey, the people at the Capitol are very pleased with the handling of the Ebola situation. I think that might have helped them in the eyes of many people at the legislature as being a model for a functional or more functional state agency related to health and human. There's a lot of Medicaid fraud stuff that's blowing up in their faces, causing a lot of bad press. The deaths in the CPS system causing a lot of bad press. We'll see. The honest answer, sir, is I don't know, but I think something big. I would assume we come out of it 1 to 3 agencies.
I've heard it compared to the changeover in '96 between the Employment Commission and
Workforce Commission, yeah. Because remember that, we passed in '95. It was interesting. That's a lot of that stuff's happening right now. That's a great analogy, actually, because a year ahead of welfare reform, we created TWC in anticipation of what the feds were doing. And I think that's a lot of this here too, is in anticipation of where the federal government's going to be going in the wake of this week's elections, and with the assumption that, there may not be a Democrat in office in 2 years.
They put a lot of perceived local control.
Yeah.
County, COG, that
Right,
kind of stuff.
with those local workforce development boards. Yeah. Mm-hmm. Other questions? Sir?
How do you view Dan Patrick's stance on immunization issues as he moves from state senator to lieutenant governor?
That's a really interesting question. And all my liberal friends get mad at me when I say this. But, one of the bills that I worked on last session was an expansion of this Texas school breakfast program. We added about 1 million kids to the school breakfast rolls. And it was I won't get into the politics and the policy of it, but 1 in 50 American school children benefited from this bill. And we expanded school breakfast to kids who were not eligible. We made it universal on really high poverty campuses. And we said that the kids who were not poverty eligible on those campuses, and there aren't very many non-poverty kids who go to 80% and above poverty campuses. There are a few though. We made them eligible. And we got serious opposition from the Tea Party, not to the idea of giving poor kids breakfast, but to the idea of expanding breakfast eligibility to other kids. And they fought us tooth and nail on it. And Dan Patrick was the co-founder of the Tea Party caucus. He voted for the bill. We couldn't get that bill heard in committee with the previous chair for 3 or 4 sessions. He heard the bill in committee. He voted the bill out of committee. He voted for the bill in committee. He voted for the bill on the Senate floor. And ultimately, Rick Perry signed the bill. And the thing to remember about Texas politics is if you think you know how somebody thinks simply because you saw their TV ads and you read what they said and you saw what their opponents said about them, if you think that translates into how they govern, you're wrong. It's just even somebody like Dan Patrick, who in his campaigning is very, very aggressive on a lot of things. I don't think he governs the way he campaigns. I just don't. And I don't know if he would be horrified or complimented to hear me say that, or a little bit of both. Probably a little bit of both. But it's I do think that we need to go into this with the assumption that Chairman Patrick understands that, or Lieutenant Governor Patrick, that immunizations save money and save lives. And the great thing about it is it's not a bunch of screaming liberals who say that. I mean, it's the medical community, it's advocates, it's the business community, it's everybody. It's common sense. And I think that because, 3 or 4 years ago, he would have had to answer to the Jenny McCarthy crowd. He would have had to, because they were the loud ones. He's still going to have to answer the Jenny McCarthy crowd because they're going to be louder than you are. If past experience bears out, they will be louder than you. They will be better organized than you, and they will be there and you won't. And he'll respond to that. Not because he believes it, but because he's a politician. So if you want those people to control the conversation, don't show up. If you want there to be another conversation, engage. On that happy note.
Jason, before we all head out of here.
Oh, the parting gift.
On behalf of the Immunization Partnership.
Thank you,
small
sir.
token of our appreciation.
Thank you.